So why is healthcare access and quality important for students? Well, accessible, high quality healthcare. They have to have that to maintain their health and well-being. And one place that we know kids are is at school. And often, especially in rural communities, that school is the core of the community. So it makes a lot of sense to do things. One of the things we talk to school districts about and school nurses about, right, is this child lost their Medicaid. One of the benefits of a school-based health center is having someone that can work with families to get back on Medicaid and keep them on Medicaid and get their services met. And then things like poverty and the environment really do keep some families from having accessible and affordable healthcare services. So this is issues like providers that can take Medicaid, providers that offer behavioral health services, and these types of things, and just not always getting the healthcare you need when you need it, can really take a toll on long-term health and even sense of well-being. And then when we promote healthcare access throughout the community and not just in our clinics, it really can serve as a prevention strategy because it puts the services where are more accessible, they're more available, and really helps people be able to have the healthcare that they need and impact and address things like their physical, mental, and behavioral health need. And even when we talk about schools, we talk about unmet needs. Unfortunately, this often can lead to family crises, things like involvement with the child welfare system, lack of school attendance for various reasons, including health reasons, can impact both involvement with the child welfare system as well as impact involvement with the justice system. So, supporting families and helping them know how to find healthcare, making it easy to get the healthcare that's needed, both can really help kids be able to be in the classroom and learn and have be in class rather than out of school for being sick or having to go to healthcare appointments. And it just really helps to remove barriers to care. So how does health access and quality impact school success? So a child that's healthy is a better learner. Academic achievement bears a lifetime of benefits for health, right? They kind of interact with each other and they're really important. I always say that nothing belongs in a school that isn't about education. So when you talk about a school-based health center, it is talking about improving at the education of kids by getting their needs met, disrupting the classroom the least. I'm a big fan of the idea that everyone in the school should do what they're best at. When we talk in healthcare, we talk about everybody acting at kind of the highest level of their licensure. So what a nurse can do, a doctor shouldn't do, things like that. And the same thing happens if you're able to meet healthcare needs, then the school nurse can focus on preventive and vaccinations and everything else. The school counselor and the school psychology teacher can be in the classroom teaching students. And those students are able to learn because their needs are being met in a way, because they're having their needs met and able to get the healthcare that they need. So we see from research that higher academic grades are associated with more cumulative and individual health behaviors among high school students. We see things like youth risk behaviors like physical inactivity and unhealthy dietary patterns, tobacco use and alcohol use are linked to poor grades and test scores. So if we can impact these things through the work that we do in schools and through the healthcare initiatives that we do, it really has an impact. Um, Evidence-based, effectively coordinated, strategically planned school health help to close academic achievement gaps and promote health equity across the school. Academic success of youth is strongly linked to their health, and it's one way to predict health outcomes, adult health outcomes, right? So if we have healthy kids, we tend to have healthy adults. And school health programs reduce the prevalence of health risk behaviors. So we do see less risky behaviors when there are access to services, including behavioral health in schools, and a positive impact on academic performance. Next slide, please. So the research says that those students who receive mostly A's versus those who receive mostly D's and F's were more likely to have injected legal drugs, 4 times more likely to have had 4 or more sexual partners, 5 times more likely to miss school because of safety concerns, and 2 times more likely to feel sad or hopeless. So we know that health and health status have a huge correlating effect with academic achievement, both directions. Next slide, please. So school-based clinics, and this is general stuff, and we're going to talk about the specifics in just a minute. I know I'm rushing through this and I'm saying a lot, but that's because what Krista and Dr. Corral have to say is so much important than anything I'm saying now. But the Community Preventive Services Task Force, which is part of the U.S. Department of Health and Human Services, it's what can we do to prevent? really recommends the implementation and maintenance of school-based health centers in low-income communities to improve educational and health outcomes. Some of the educational outcomes that they highlight, so these are proven, the science shows that in school districts, low-income districts that have school-based health centers, you have a better school performance, more students being promoted on time to grades, better high school completion, reduced education gaps between students. Some of the health outcomes you see, students are better vaccinated and they have their other preventive services met. You have lower asthma morbidity, reduced emergency department and hospital admissions, which reduce the cost for healthcare for all of us, and a reduction in health risk behaviors in those students.